China has banned the import of all cloven-hoofed animals and their products from South Africa. That's due to the recent outbreak of foot-and-mouth disease in parts of the country. Let's discuss this now with Dr. Mpho Maja, Director of Animal Health in the Department of Agriculture, Forestry and Fisheries. Dr. Maja, good afternoon and thank you very much for your time. Just about an hour ago or so, I interviewed the Cape Wool's South Africa, who were just telling us about the sheep industry and how they were affected by the ban from China, and things are not looking good, and they are hoping that the ban will be short-lived. But now, for it to be short-lived, I guess the matter of foot-and-mouth disease has to be proven to have been contained. What efforts is the department currently undertaking with the farming community to contain the spread of the disease?
Thanks, Dan, and good afternoon to you and to the eNCA viewers. We are engaging with China. We are also engaging with all of our trade partners. China, being one of the big trade partners, was one of the first that we made contact with when the case in Northwest was reported. So we are in constant communication with trade partners, including with China.
Is it only the Northwest currently where you've seen the emergence of the disease, or are there other parts? Earlier, I thought I saw a report that mentioned a couple of other provinces.
As we speak, we are sitting with 3 outbreaks. We have the ongoing outbreak in KZN, the Tuba, Nongoma, KCD area. We are vaccinating in that area. We also have an outbreak in Limpopo, in the Collins Chabane area. We're also vaccinating in that area. So these are the outbreaks that are relatively oldish. The newest case, which was reported 3 weeks ago, is the Northwest outbreak in Potchefstroom area. And unfortunately, a few animals were moved from Potchefstroom to one farm or one location in Gauteng, which has subsequently also tested positive, as well as one location in the Free State, which also tested positive. So on the Northwest outbreak, we are sitting with about 7 confirmed infections.
Okay, so Northwest is just one of the provinces that are affected. You've mentioned vaccination. How is that campaign going?
KZN started 2-3 weeks ago with the vaccination, and it's going very, very well. So far, they have vaccinated close to 70,000 cattle. Limpopo is starting with their vaccination this week or latest next week. So they will be vaccinating the Thulamela area, and we anticipate that that will also go well.
Okay, now let's go back to the issue of the ban, like by China. We understand the industry is feeling the pain in terms of that. You said you are also engaging not just with China as the biggest, but with other trade partners. What is the message you are giving them, and what is the kind of response you are getting from South Africa's trading partners?
So far, the message that we have given to the trade partners was an early alert that we have picked up infection outside of the areas that we were used to or that we had reported earlier. As the information becomes available, we update the trade partners. We release a fortnightly technical report which bears all of that information, and that information is also shared then with the trade partners, especially our neighboring countries.
Okay. Do you anticipate that you'll be able to really get this under control and stop this disease, or should the industries that are trading in these animals brace themselves for a longer, extended period of trade difficulties?
With regards to the controlling of the disease, I am very optimistic that we will contain it. But we do need the help of the industry. Mainly foot-and-mouth disease is transmitted through movements of cattle. And it affects literally all animals except for chickens and horses. So all industries need to hold hands and curb the spread of the outbreak. With regards to trade, most of our trade partners since January of 2019 have been accepting products or commodities from us where the risk of foot and mouth disease transmission has been mitigated. For example, with wool, we store it at a pre-agreed temperature, 18 degrees Celsius, which then mitigates the risk. So whatever we export to China has the risk of foot and mouth disease mitigated. So we are hoping as they get confident with the measures that we have put in place, trade will resume.
Okay, I don't want our viewers to think we're only worried about trade because industries make money. But what about internal consumption? I mean, is our meat currently safe to consume with this foot and mouth disease outbreak in the different parts, including the Northwest as the latest province?
Definitely. I like that question because I love my meat. Foot and mouth disease, fortunately, does not affect people. It only affects cloven-hoofed animals, and it actually makes them sick for a very short period of time, 2-3 weeks at the very most, and they recover. The reason that it is such a hyped-up disease is because of its trade sensitivity. People do not get sick from eating meat that is from animals that are infected with foot and mouth disease. So the consumers have nothing to worry about. We can happily go ahead and eat our steaks and lamb chops.
Okay, and I can see you really love your meat. The neighboring countries, finally, Dr. Maja, because you collaborate with everybody from what you've said, do we have incidences of such in the neighboring countries like your Eswatini, Mozambique, and stuff like, and places like that?
Incidences of foot and mouth disease in the neighboring countries?
Yes. Are you aware of any?
Is that the question? Some of the neighboring countries like Botswana and Namibia, they have zones that are free of foot and mouth disease, and then they have zones where infection is more common. Countries like Mozambique and Zimbabwe have foot and mouth disease endemic, and countries like Eswatini and Lesotho, the two kingdoms, the entire countries are free of foot and mouth disease.
Okay, thank you very much for your time and your explanations there. Dr. Mpho Maja, Director for Animal Health from the Department of Agriculture, Forestry and Fisheries. We know what is one of her favorite things that goes on her plate every day when she has a meal. Thank you very much for that. Now.